Well, I think one of the trends that's important for BC First Nations people to know about is that oftentimes cancer is not diagnosed until a later stage. And that's because people aren't accessing screening earlier. And that's probably for a variety of reasons. One is having access to screening in the first place. For example, having access to mammograms. I know that there's a mammogram bus that goes around in the north on a certain route, but some of the people on a different highway don't necessarily have access to that mammogram bus. I think the other issue is that access also means that people, even if a service is available, they're not using that service out of a fear or anxiety about how they're going to be treated.
Absolutely. And I think the other thing too is with time and the work that's being done, part of it is whether it's the access that's the problem or the safety, the cultural safety of those services. It's also knowing what's out there and why cancer screening is important, what you need to do it, why you need to do it, and then really being able to advocate for yourself and your loved one and say, this is what I know I need to do. This is what I know my mom needs to do, or my grandmother, or my daughter, or my brother, or my father, or my great-grandfather, and basically really looking after each other and that what we call sort of the awareness of this, and also knowing that you deserve this. This is your right. This is your right to have the choices and to make the choices that will hopefully pay off in terms of prevention and early detection of cancer.